viewers, today I will discuss about one of the important topics in OBG, that is uterine cephalic version. For the exam point of view, it is very important for the nursing students. You can expect this question 100% in your examination. So without wasting time, we will move on to our today's topic, that is uterine cephalic version. Uterine cephalic version refers to the procedure of manually turning a fetus inside the uterus to a head-down position, usually done in late pregnancies when the baby is in a breech or transverse position. This procedure increases the chances of a vaginal delivery. First of all, I will explain about the types of cephalic uterine version. There are three types of version. First one is external cephalic version. It is manual turning of the fetus from breech or transverse to cephalic by applying pressure on the mother's abdomen. It is performed by obstetrician in a late pregnancy, especially between 36 to 37 weeks. Second one is internal podalic version. The obstetrician insert a hand into the uterus to turn the fetus to a breech or podalic position, typically during delivery. It's performed by skilled obstetrician during second stage of labor, usually in twin deliveries. The third one is combined version, a combination of both internal and external manipulation. One hand inside the uterus, the other externally on the abdomen. It is very rare, usually performed in emergency cases during complex cases. Among these three types, today I will explain about external cephalic version in detail. An external cephalic version is a non-invasive obstetric procedure performed in the late third trimester to rotate a fetus from a breech or a transverse position into the cephalic position. The goal is to enable a safe vaginal delivery and reduce the need for cesarean section. Here I will explain the timing of external cephalic version. In case of singleton pregnancies, it can be performed in 36 weeks, especially for the nulliparous woman. Whereas in case of multiparous woman, we can perform it in 37 weeks. Usually allows spontaneous version before labor. It helps to reduce the risk of preterm labor if complications occurs during the procedure. Now I will explain about the indications of external cephalic version. The first one is woman with a singleton fetus in breech or transverse lie. It should be performed at or near term, that is after 36 weeks. It will be performed with a normal amniotic fluid volume. Also, it can be performed with no contraindication for vaginal delivery. So these are the indications of external cephalic version. Next will be the contraindications. Contraindications can be divided into two, that is absolute and relative. We'll see the absolute contraindications. These are placenta previa, uterine rupture or previous classical cesarean scar, severe fetal growth restriction with the abnormal Doppler, oligohydramnios, multiple pregnancy and major uterine anomalies. The relative contraindications include recent vaginal bleeding, abnormal fetal heart racing, ruptured membrane, maternal hypertension or preeclampsia and active labor. Here I will explain about the pre-procedure assessment of external cephalic version. In that, first one is ultrasound. Ultrasound can be performed in order to confirm the fetal position, placental location, fetal well-being and fluid volume before the procedure. Next one is cardiotocography. It is very important to perform the cardiotocography in order to identify the baseline fetal heart rate and reactivity. Next one is informed consent. Informed consent is very important. The doctors has to explain the risk, benefit and alternative before the procedure. Next one is maternal blood type. Rhesus negative mother should receive anti-D immunoglobulin. Last one is tocolytics. Example, terbutaline 0.25 mg subcutaneously are given to relax the uterus. Here I will explain the procedure of external cephalic version step by step with the help of a video. In that, first one is positioning. Woman lies in a supine or slight Trennenberg position. Next is monitoring. Continuous fetal monitoring before, during and after the procedure. Next one is lubricant. It is very important to lubricate the abdomen before the procedure. Next, with the help of a first hand, elevate the fetal breech from the pelvis. At the same time, second hand guides fetal head towards the pelvis. The fetus is gently rotated in a forward roll or backward roll motion. Ultrasound guidance is very important to perform throughout the procedure in order to identify the correct procedure. The normal duration will be 5 to 10 minutes. Multiple attempts may be made if well tolerated. This is about external cephalic version. I think we can wind up our today's section. The procedure will be explained with the help of a video. I think that will be useful for you. So the benefits, risk, complications and post-procedure will be displayed on the slide. Please have a look on it. The next class, we will meet with another episode of midwifery topic. Till that, take care. Bye-bye.